Hello friends, hope you are all okay, you are enjoying, and welcome back to ultrasound teaching videos with Dr. Arshad Nadeem Awan. You have been waiting for the videos to upload, but because of certain commitments I was a bit busy. So today I'm here and I will start the new topic. As you all know that we have already discussed about the liver, we have discussed about pancreas, and also discussed about the gallbladder at length. We have discussed almost all the aspects related to all these three organs. Today I am going to start the spleen and the splenic components. Spleen, actually, it is a very vital and important organ of the body. It performs certain important functions, and because of any abnormality of the pathology of the spleen, we face certain abnormalities. So how a spleen looks on the ultrasound imaging, what is the normal size of the spleen, how its parenchyma will look, how the border will appear on the ultrasound imaging, what are the normal value of the normal spleen, and how we will rate the splenomegaly, what are the different other aspects. There are certain normal variants, so all these points would be included in this video. So let's start watching these videos. This is normal spleen image on ultrasound. Here on this image, posterior superior aspect of the spleen is obscured by the air within the lungs. Aerated lungs obscure spleen. The best way to view complete image of the spleen, put the patient in decubitus position and ask to take deep breath in. When the patient will be inspiring, spleen will slip in the view and you can take the image to analyze it. Here in this image you can appreciate the normal spleen image. You can look for its smooth outline. Borders of the spleen are smooth and regular. There is no irregularity visible, while in some cases you may appreciate irregularity of the spleen border as well. But here this is actually the normal spleen, so smoothness of the borders can be easily seen. You can appreciate its upper, lower and mid pole, as it is divided into upper, mid and lower pole, so all these three poles can be seen easily. Splenic hilum and splenic vein is visible. Parenchyma of the spleen is also homogeneous. No solid or cystic mass is seen, and spleen is also not enlarged. Before going to discuss about the spleen, its normal size, its shape and its other component, you should have the knowledge of 9 abdominal quadrants. Certain imaginary lines divides the abdominal cavity into 9 quadrants, and every quadrant specify a particular location of certain organs. So therefore you should have the knowledge of 9 abdominal quadrant. In next video I have explained these 9 quadrants, how it is important and what organs you can specify within these 9 abdominal quadrants. So before going to jump over the next splenic issues, let's start having a look for the 9 abdominal quadrant. Before going to talk about the relationship of different structures with the spleen, it is important to talk about abdominal quadrant, which specifies the location of different intra-abdominal organs for understanding. It's the image clearly showing 9 quadrants. Spleen lies in the left hypochondric region. On the right, it's right hypochondric region, which is for the liver and gallbladder specifically, while spleen is located in the left hypochondric region. You can appreciate both right and left lumbar iliac regions. Epigastric, umbilical and hypogastric regions are also specifying certain organ locations, which we will discuss in later videos. In this image you can appreciate spleen, but superior to the spleen, hypoequic liver left lobe projection can be seen. In few cases where hepatomegaly occurs, left lobe might slip into left hypochondric region and rest on the superior border of the spleen, which should not be confused with any mass lesion, as it mimic like there is some mass lesion on the superior part of the spleen, but actually this is the left lobe which is projecting on the superior surface of the spleen. It's another image. Spleen is clearly visible, but again left hypoequic liver lobe can be seen on the superior aspect of the spleen. In view, left kidney can also be seen. In few cases, liver might not be enlarged, but you will still appreciate left lobe, or sometimes angulation of probe will project the left lobe of the liver in view. Quite often, this can be seen when liver gets enlarged. Here is the example of enlarged fatty liver. You can see echogenic left lobe of the liver resting on the superior border of the spleen. Spleen looks hypoequic, that is due to contrast effect. As liver is more echogenic, therefore comparatively spleen is looking hypoequic. So the relationship of spleen with normal liver and enlarged fatty liver has been discussed in these slides. For better understanding, CT image has been included to see the status. On the CT image, liver and its parenchymal, intraparenchymal vasculature is clearly visible. Liver appear hypodense on the image due to fatty deposition. Large left lobe is protruding into left hypochondric region, and it is clearly seen that liver lobe is covering superior and lateral margin of the spleen. It's hepatic steatosis with hepatomegaly. Common relation of the spleen with left kidney, which can be easily appreciated while scanning. In this image, along the medial border of the spleen, left kidney is visible. Spleen upper, mid and lower pole is clearly visible, while left kidney with its cortex and medullary region can also be seen clearly. So this is the only relation which you can easily appreciate while you scanning, and put the patient in decubitus position and ask the patient to take deep breath, so you can easily see the spleen relation with the left kidney while you are scanning the patient. This is another organ relationship with spleen. In this image you can see tail of pancreas. On ultrasound view, you can appreciate tail of pancreas if you pay little attention. Ask the patient to make the decubitus position, scan the spleen and try to visualize the pancreatic tail. It would be just there. Pathologies of pancreatic tail can be picked at this region. So concentrate on different organs relationship with spleen, as it's the important quadrant where you can pick a lot of pathologies related to different organs, especially the tail of pancreas. Majority of the pancreatic tail tumor can be picked in this position by focusing the spleen and its relationship with the pancreatic tail. In this image, spleen border is making interface with diaphragm. On this image, you can appreciate a bright reflective line that is actually diaphragm. Behind the diaphragm, aerated lung is visible. At this area, you can pick even minimal pleural effusion up to few millimeter, while X-ray is unable to pick this much amount of pleural effusion. In this image, you can see spleen relationship with left kidney, with diaphragm, and in view you can also appreciate aerated lungs. As you all know that all human being has been gifted certain qualities. Every individual is different from the other individual. There are certain criteria for the organ locations and organ size and its shapes, but in some beings you will come across certain different conditions, certain different shape, certain different size. As far as spleen is concerned, there are certain normal variants which are totally normal, that would not be abnormality and that would not be labeled as an abnormality, but you should have the knowledge which type of a normal variant you can come across so far the spleen is concerned while doing ultrasonography. Like there are wandering spleen, there are spleniculus, there are splenosis, there are splenogonadal fusion and many other. How it will appear on the ultrasound imaging, how we will appreciate all that, how we will document all that, and we should not confuse this with any of the pathology. So therefore these next slide shows different variation, anatomical variant for the spleen. On this slide, a well-defined hypoequic round nodule can be seen. pointed by the tip of white arrow, this is spleniculus. It is actually ectopic splenic tissues of congenital origin. It can be single or can be multiple and usually found at the splenic hilum. It should not be confused with hypoequic mass because it is a congenital variant, and some individuals you may come across with spleniculus, which is a normal variant. On this image, again, two small well-defined hypoequic nodules can be seen in the hilum region, pointed by red arrow. Spleen is visible. Spleen is slightly enlarged in size. These two small nodules are spleniculus, which I have mentioned earlier. In the previous image you could see single spleniculus, while in this image these are two spleniculus, and it may appear in multiple form as well. So you can see multiple spleniculus as well. So you should not confuse with any mass lesion because it may make like there is enlarged mass or this is small nodules, but these are actually normal variant and it is called as spleniculus. This is the image of wandering spleen and pointed by white arrow you can see in this image. This is a normal variant. Here you can see that spleen is low-lying and its location is ectopic. This happens when the suspensory ligament which support the spleen becomes lax. So laxity of a suspensory ligament causes wandering spleen. Only one common pathology is related to this sort of a spleen is that it twists around the ligament and causes torsion, resulting into ischemic necrosis. On this image, multiple round, hypoequic, well-defined nodules are seen in the vicinity of spleen. These are actually splenic tissues and this condition is called as polysplenia. The spleen is divided into 2 to 16 masses. Up to 16 masses it can be divided in polysplenia condition. This is congenital syndrome associated with situs ambiguus because there are some situs abnormalities. So situs inversus, situs ambiguus. So this polysplenia is related to situs ambiguus, as well as cardiovascular and visceral anomalies can also be seen. Multiple organ congenital pathologies would be seen in this type of case, so always look for other congenital abnormalities in polysplenia. This is the CT image of the polysplenia patient. On this image you can see three well-defined hyperdense solid looking round masses in the vicinity of the spleen. So this is the example of polysplenia. On this image liver is clearly visible. On the right side kidney is visible, left side kidney is visible. On the kidney superior to the left kidney you can see this polysplenia. Splenogonadal fusion, its congenital anomaly. You can see in these 4 ultrasound images that a small testicular tissues are attached with the spleen. This is splenogonadal fusion. It is usually seen in male patients when the scrotal compartment is empty. Besides scanning abdominal cavity, inguinal canal, always scan the spleen area because there will be possibility of a splenogonadal fusion because it is a congenital anomaly and you can see on the images clearly. In case of any doubt for the splenogonadal fusion, always advise further radiological imaging, especially CT scan and MRI. On this MRI scan, on the left side, these arrows are indicating a long spleen which is connected with the testicles. A testicle is also pointed by the arrow. So this is again confirmation of the splenogonadal fusion on the CT and the MRI. So always advise further radiological imaging. After trauma or rupture of the spleen, splenic tissue may get auto-transplant and appear like the way you are seeing in this image. This is called as splenosis. On the right side image, normal spleen and normal left kidney is visible, while on the left side a round nodule is seen. This is actually splenosis. This is not the mass. This is the spleen tissues. After rupture, this is auto implant here and this is called as splenosis. So there will be history of trauma or rupture of the spleen would be present. Splenomegaly. Enlargement of the spleen is called as splenomegaly. For the splenomegaly, you have to measure the spleen in both in longitudinal and in transverse. There is certain criteria. Normally, it has been published like 13 centimeter considered to be a normal size of the spleen. If a spleen is increased than that, you can label that as splenomegaly. But further, there is certain criteria, like there may be a mild splenomegaly, a moderate splenomegaly, or severe, or sometime massive splenomegaly. So from 13 to 18 centimeter, anywhere you can label that it fit between mild to moderate. If it crosses 15, so then you can call it moderate splenomegaly, and after 18 you can call it a severe splenomegaly, but more than 25, that you can consider it as a massive splenomegaly. Splenomegaly indicates certain disease processes. It indicates certain abnormality. It responds to certain pathological condition. So therefore you should have to be very careful while measuring the spleen. Sometime, if because of the wrong posture or because of the angulation of the probe, the spleen looks wider, or sometime if there is enlarged spleen, because of the angulation you still label it as a normal spleen. So therefore be careful while scanning, while measuring the spleen. So a further slide shows what are the differential diagnosis for the splenomegaly, how you will label that and how you will differentiate that, and especially on the ultrasound imaging how it will look. So let's start watching next images. This is the image of enlarged spleen. Spleen is enlarged in both longitudinal and transverse direction. Left kidney is visible in this image. Splenic parenchyma is homogeneous and there is no space occupying lesion in it. Neither solid nor cystic lesion can be seen in this spleen. Margins of the spleen are also smooth, no marginal irregularity noted. So this is typical splenomegaly. Always take the measurement and write on your report. Here on this CT image you can appreciate enlarged spleen. Both kidneys are seen in the image. Liver portal vein is also visible. So this is the image of splenomegaly without any focal lesion. So there is no intraparenchymal lesion. So lesion is not there. So this is simply splenomegaly, and you can easily appreciate on this images. Mnemonic China is used to describe the differential diagnosis of the splenomegaly. This is the chart which explains the reasons of enlarged spleen. The first one is a congestion caused by portal hypertension. This portal hypertension may be due to many reasons like liver cirrhosis, or there is any cardiac problem or renal problem which contributes in portal hypertension. So the spleen would be enlarged. In hematological conditions like hemolytic anemia and sickling of erythrocytes, both causes enlarged spleen. Certain infections including malaria, Epstein-Barr viruses, leishmaniasis and other infections leads to enlarged spleen. Certain neoplasms, especially in chronic myeloid leukemia, the spleen gets enlarged. In myelofibrosis and in lymphoma, especially the liver would be enlarged. In autoimmune, especially rheumatoid arthritis, sarcoidosis and amyloidosis, the spleen would be enlarged. There will always be history available. There will always be other investigation available. Whenever you come across with enlarged spleen, always look for the history, always look for the other investigation to rule out the exact cause. Normal spleen size is considered up to 13 centimeter, and if it is enlarged more than 13 centimeter, it is categorized in mild, moderate and severe status. More than 18 centimeter is considered to be a severe case, but sometime it may reach up to 22 and even more than that. That would be called as a massive enlargement of the spleen, which can be seen in malaria and myelofibrosis and chronic myeloid leukemia. If you come across with massive enlarged spleen, always think about these three conditions. Malaria, there will be clinical history and symptoms of the malaria which can easily be distinguished from the other neoplastic conditions. But in chronic myeloid leukemia, the spleen would happens to be enlarged, massively enlarged. So this was all about the spleen. We have discussed at length how a spleen will look on the ultrasound imaging, how it will appear, how the parenchyma will look, how we will see the associated organs adjacent to the spleen. And beside this, we have also discussed at length what are the normal variants. If there are normal variants, you have to document all that. So defining all these things is rather easy. Appreciating on the ultrasound imaging, I'm sure it would not be a great deal, but so far writing or putting into practice or putting into black and white, that is very important. You have to be very careful while you are writing report. Your every single word matters a lot. So far the splenic reporting is concerned, first of all, you have to mention that what is the size of the spleen. Always document the size of the spleen on your report. Beside this, also look for the margin. Is there any marginal irregularity? Always look for the parenchyma. Is it parenchyma homogeneous? Is it heterogeneous? Is any disease processes going within the parenchymal region? You must document whether there is some solid mass or cystic mass, or especially the one in the more important thing, certain time there might be an infarction of the spleen is very common, so you have to document all that thing. As far as the abdominal or splenic variant are concerned, you must mention that this is the size, this is the area, this is the location, this is a specific position of the normal splenic variant. And if you are confused, must mention that please further confirmation from the other radiological imaging is recommended. At the end, you must conclude. What is your conclusion? That is very important. Many of clinicians always skip that point. Many of clinicians, because of certain reason or because of hurriesome or lack of time, they skip that part. At the end, that is very important to help your colleague. If you think you've been supported by further documents, so you must correlate with all these previous investigations and write your diagnosis, write your differential diagnosis. So in this video, I have also explained the differential diagnosis, which are very common. Just ask a few questions from the patient. If there is certain reportings, you take the reports and take the investigations and pin down your conclusion. And if in case of any doubt, further radiological imaging, especially CT scan or MRI, you must recommend. I do hope you would have enjoyed that video, and keep watching my video. In the next videos, I will discuss about the different pathologies of the spleen. Do not forget to give me your feedback. Keep watching my video, keep sharing my video. So see you in the next video. Till then, take care. Bye bye.